This is the OHSU Effect Inside Health and Science. Welcome back and good morning. Here is an alarming statistic. By the year 2030, there will be 71 million Americans older than 65. That will be about 20% of our population. And all those people will start suffering from age-related problems at the same time. Doctors and researchers at OHSU are trying to prevent that bubble. With me now on the OHSU Effect is Dr. Elizabeth Ekstrom, Director of Geriatrics at OHSU, and Dr. Henrik Urbanski, Senior Scientist and Professor. Good morning.
Good morning, Lacey.
So, Henrik, why don't you tell us why OHSU started this new group to focus on aging?
Well, the simple answer is there are many people at OHSU working on various aspects of aging, but we're trying to speed up this translation. That is, to speed up the translation of basic research findings, to translate them to the clinical field, and then further to translate them to the health care delivery system.
Elizabeth, what are the biggest concerns facing those who will be retiring in the next 10 years or so when it comes to healthcare?
Well, unfortunately, in our society, multiple chronic illnesses are increasing in frequency, such as diabetes, obesity, all of those kinds of things. As people start to retire, they're going to need to stay active and healthy and managing their diet and exercise and all of those things so that they can not succumb to chronic medical illnesses and have functional decline as they move into their retirement years. A lot of people think their retirement years are going to be great and healthy and travel, and we know that a lot of times what really happens is people start to have medical illnesses and problems. And the only way we're going to really support our older population as they start to retire is if we can curtail those chronic illnesses, bring a team-based approach to care, ensure that everybody has good training to take care of an older adult population. And I think that's what we're really working towards, is thinking about interprofessional education, bringing in all of the team members and giving them really good competencies to help improve function and quality of life for our older adults.
Yeah, specifically, what needs to change to prepare for the growing number of aging Americans?
Well, number one, there is some research out there about maintaining exercise and diet and reducing stress and improving sleep and those kinds of things, but there's a lot more research to be done. And Henrik can tell us more about some of his sleep studies and things. You know, we know older adults are different in a lot of ways. They have different sleep patterns. They're not as resilient. So if you get sick, you don't heal as quickly. And you might have functional decline. If somebody who's 40 goes into the hospital with a heart attack, they're probably going to be able to come out and go back to exercising and back to the things they were doing fairly quickly. If an 80-year-old has that same heart attack, it could take them weeks to get back to even being able to bathe and dress themselves. So there are a lot of differences that are taking place. And right now, there are very few healthcare people who have added competencies in geriatrics. So most of our nurses, pharmacists, social workers, doctors, all of those kinds of people don't have any extra training in geriatrics. So they're not going to be prepared for the special needs of the older population. So we need to target both the research on medical illnesses in older adults and on training the people who are going to be caring for them, because it's so important that we're all working together to kind of beat this wave.
Yeah. So, Henrik, why don't you tell us about your research and what else OHSU is doing to influence this change?
Well, the first thing about aging, it's not really a disease. We have to make that clear. It's a continuous process, and so it's very difficult to grasp the various systems that are interacting, and traditionally people have studied those systems independently. What we're trying to do is to do a more kind of holistic approach to look at various systems. One example is if you look at perturbed sleep, we find it's associated with impaired immune function. Also, we seem to find a correlation with impaired cognitive function. So clearly there's some kind of underlying common mechanism here. So we're trying to get at the root of this common mechanism. That way, we may have a better chance of coming up with more effective and safer therapy.
How are aging patients different when compared to middle-aged patients?
Yeah, well, as I mentioned before, it's about the resilience and just function. And, you know, with young people, they might have multiple chronic illnesses, but they tend to be able to kind of maintain their work and maintain, take care of their finances, be able to take care of their families, things like that. As you get older, your illnesses have greater impact on your function. So what our hope is that we can work together. And I really like Henrik's example of sleep because, memory and function in sleep and your immunity, your ability to fight off common colds and things like that can become greatly impaired as you get older.
Just about 30 seconds left, but what else needs to be done in order to prepare for Oregon's aging population? And where can people get more information about the research you guys are doing?
Well, first of all, we need to be really good about working together and pulling people together and even working with our legislature to change how healthcare is financed. Let me turn it over to Henrik to talk briefly about the education side of things, because there's some exciting things going on there, too.
Yeah, sure.
Yeah, one of our goals is to train the next generation of scientists and clinicians to be focused on aging research, because, as you pointed out, it's a little bit different from studying aging in young or young adults. And we have various programs we're involved with. The J.T. Murdoch Charitable Trust has a Partners in Science program. This focuses on high school teachers and high school kids. We also have a training grant from the National Institute of Aging to train postdoctoral fellows and PhD students. So we're going in the right direction.
Great. Well, Dr. Elizabeth Ekstrom, Dr. Henrik Urbanski, thank you so much for being with me.